Well, hello everyone. I hope you're having a great day today. We are going to get started with chapter 1 with talking about the introduction to nutrition for health, fitness, and sports performance. It's what this class is all about. So more of a perspective looking at health and fitness as well as our sports performance today versus nutrition, but we'll talk a little bit about that part of it as well. So really, if we look at, and especially in today's world, we're all about sport and exercise performance. Two factors that make that up the most is looking at our genetics, so our stature, whether we're tall or short like me. Looking at body composition. There are some sports that do well with a higher body composition than others, as well as our VO2 max. Those are things that can be genetic, as well as our vision. But also looking at training, that we know that there are optimal physiological, psychological, and biomechanical training that we can do to help improve our sports performance. So if we look at physical fitness, it is defined as a set of abilities an individual possesses to perform specific types of physical activity. There are actually two types of physical fitness. One of those is health-related fitness, which is probably what we hear about the most, especially in the news. But also sports-related fitness. So we're going to talk a little bit about both of those today. So what is health-related fitness? It looks at healthy body weight as well as body composition. It looks at our cardiorespiratory fitness and whether or not we have adequate muscular strength and endurance, whether or not we're flexible, and some other measures. So looking at our blood pressure, bone strength, postural control and balance, and also looking at markers as far as our cholesterol is concerned. So looking at carbohydrate and lipid metabolism. So if we look at our health-related fitness components, we're really looking at our cardiorespiratory fitness. So how fast can we run a mile? As well as our body composition. So how much body fat we have as compared to lean body mass. And then muscular strength. So how much weight can we lift with that bicep curl? But also looking at muscular endurance. So how many repetitions can you do a sit-up or your hamstring flexibility? And so not just looking at hamstring, but our flexibility overall and muscular endurance overall as well. So if we look at physical activity, it is defined as the movement caused by muscular contraction that results in caloric expenditure. Now that can be broken down into unstructured physical activity, which could be our activities of daily living. So walking around the house, things of that nature, versus structured physical activity, which is more of our planned exercise program. So our running, it could be an aerobics class, swimming, weightlifting, whatever it is, it's something that's a little more structured by nature. So what are the basic principles of exercise training? These are all included and something that if you are going to be working with people on their exercise program, then you need to know these basic principles for exercise training. And we're going to go through those here in just a moment. So first we talk about principle of overload, and it is it's a basic principle of exercise training. We need to look at our intensity of exercise. So intensity is often evaluated by percentage of our heart rate, so 70 to 85% of our maximum heart rate, or it's looking at our maximum oxygen uptake. And so with that, usually doing a VO2 max on a treadmill and looking at how much carbon dioxide we're breathing out versus oxygen that we're taking in. We can also look at what kind of metabolism we have by looking at that as well. So how much fat we're burning as compared to carbohydrates. And they can use that information in a hospital to determine what kind of diet you give a person based upon their VO2 max or their maximal oxygen uptake. Another way to look at intensity of exercise is in the strength realm is how much percentage of how much they're lifting, so 70 to 85% of their bicep curl, or looking at a repetition maximum. So they do one repetition, that's all that you can do Usually you do that with testing, and then you set a percentage of that based upon how well you did. Another way of looking at overload is duration of exercise. So time of your exercise session. Trying to create an overload with that, starting out with 30 minutes and building on to that. And then another way of looking at it is frequency of exercise. So how often are they going to be exercising each week? So really we look at all of these principles when we're setting someone's exercise program: intensity, duration, and frequency of exercise. Another thing we look at is the principle of progression. So creating an overload, it's a gradual increase in overloading what they're training. So gradually trying to increase their speed or the amount of weight lifted. You don't want to do it all at one time, because number one, they'll get sore and not want to come back. And that's your primary reason. You want to make sure that you're doing it for safety purposes as well. So if we look at principle of specificity, Hans Selye and his SAID principle, or SAID principle, it's looking at specific adaptations to impose demands. So depending upon what their goals are as far as their training is concerned, if they're running a marathon, then they're going to be endurance training versus strength training. Now, I would say really if they're going to be marathon training, they need to be doing both. So looking at the demands of that sport and determining what their goals should be in reference to endurance training and strength training. So with principle of recuperation, your body needs time to recover and rest so that it can rebuild. And so within that exercise session, you should have time to recuperate before you do another exercise. So if you do 3 to 5 repetitions on a bench press, you need to make sure that you give them time to recover before you go again. And I would say the higher the intensity, the lower the repetitions, the more time you need in between, versus someone who's working on endurance and doing 12 to 15 repetitions. You may want to work more on aerobic type of fitness and try to get back at it as quickly as possible. But also between your exercise sessions, you'll find that you need recovery between to rebuild, and so that you can do a better job the next go around. So with the principle of individuality, we all are very different, so how we respond to exercise is very different. One marker of looking at an individual response would be looking at their blood pressure. And for someone who has high blood pressure and they exercise, they could respond very well. Their blood pressure is lowered and they can possibly get off of any medications that they are taking. But there are also some, having had experience with this, that they just don't respond well with exercise. Their blood pressure just doesn't respond, and so there's not a change in their blood pressure. A lot of times you'll see an acute response, one that is immediately with the exercise. While they're exercising, they may have some benefit, but it's not necessarily something that's chronic. Now, for the most part, you will see those that do exercise on a regular basis that they do start to see some decrease in their blood pressure or their blood sugar responses or things of that nature. Now, with principle of reversibility, it's a thing of you got to use it or you lose it. And so the idea would be hopefully that you exercise and maintain a lifestyle of exercise. It is possible to decrease those health gains that you've built up over a period of time. And so it's something that's very important, again, to make sure that you are using it and building upon that. So there are some beneficial effects of a single exercise bout. You'll see with lower blood pressure or lower decreased sugar response. But ideally where you want for them to get the best benefit is for them to be exercising on a regular basis for maximal health benefits. Now, there are those that tend to overtrain, and with that, the principle of overuse. So you've gone too far. You've exercised too much, and there are adverse health effects to that, with muscular injuries as well as stress fractures. I'm kind of dealing with some of that myself. I have some back trouble that I've been working on for the past year and a half. And the problem is I love to exercise, and it's almost to that point where I'm hurting myself, and I've got to stop and just kind of regroup to get back to a healthier point. So anyway, so the role of exercise in health promotion is really to help. And you can see here it's sedentary death syndrome. It's kind of a spin-off of SIDS with infants. And so really sedentary death syndrome is a health problem that's related to physical inactivity, and it was founded by Frank Booth at the University of Missouri. Basically what they find is that with physical inactivity, there are short-term costs in that you do see a deterioration in your metabolism, and with that you start to gain weight. I kind of noticed that whenever I was teaching quite a few. I was teaching like 3 physical activity classes a day, and when I stopped, I started to see the changes, and I knew it was coming, and I was worried that it was coming. But there are those short-term costs. Now, intermediate costs of being physically inactive is the possibility of type 2 diabetes. Now, we know that that is something that can be prevented if we are exercising and watching our weight. But the long-term cost of being physically inactive is that there is an increased rate of premature mortality. So someone dying before they really need to. So if we look at the role of exercise in health promotion, we know that physical inactivity in itself, there is an increased risk of coronary artery disease by 45%. There's a 60% increased risk of stroke and hypertension and osteoporosis. So we know that there definitely, and these are from the United States Centers for Disease Control and Prevention. So we know that there is a benefit to exercise and health. One of those health benefits of exercise is that it helps prevent pre-disease conditions. So it helps to decrease the body weight or abdominal fat in particular. Also helps to decrease blood glucose, and it helps to prevent type 2 diabetes. Now, what they're calling diabesity is that combination of body weight, elevated blood glucose, and diabetes. So diabesity. And in the year 2000, they found that we have 171 million people worldwide that have been diagnosed with type 2 diabetes. And by the year 2030, they're expecting for there to be about 366 million people. Again, it's a projection, but we are pretty well straight on with that. So ACSM, or American College of Sports Medicine, termed the exercise as medicine. And so we firmly believe that there are health benefits associated with exercise. We know that it helps to increase bone density and strength. It helps to reduce blood pressure, helps to improve our sleep, and with that, it could also be our productivity. It helps to increase our strength, flexibility, and balance, and thus reduce the risk of falling. So with that, some of our possible health benefits of exercise are an improvement in our self-image. We feel better about ourselves when we exercise. We're doing something that gives us control of our lives, and so there are improved immune functions as well as reduced arthritis pain, enhanced blood lipid profile or cholesterol. So how does exercise enhance our health? Not all of the mechanisms are noted at this point specifically as to how it helps to enhance our health, but a couple of the theories are with physical inactivity in particular. It has a tendency to cause an impaired gene function, as well as there are cytokines that tend to induce gene expression, and with exercise there are fewer glucose receptors in fat cells. So with that, the exercise, now another attribute to that is that exercise may cause the expression of genes with favorable health effects. We're going to talk about those here in a bit. The cytokines induce beneficial gene expression and therefore more glucose receptors in the fat cells, so being able to take up that glucose and do something with it. So with that, exercise helps to stimulate the release of substances from muscle cells known as cytokines that might possibly affect the genome, epigenome. These cytokines are, are similar to hormones and can affect tissues throughout the body. They enter various body tissues and influence gene expression that may induce adaptations either favorably or unfavorably to health. Now with that, you have your muscle cells, and they are called myokines or exerkines, and you can see they affect both of these different factors. Adipose cells, the cytokines there are called adipokines, and they deal with tumor necrosis as looking at tumor death. And so with that, our, I'm going to go back one more time. Yeah. So possible role of cytokines to induce favorable health effects. If you look at it, the hormone or cytokine, it enters, it is activated, the receptor is activated, and then there's a signal transmission that occurs along that pathway, and the cellular response is where everything happens, and it can there's a gene regulatory protein that can alter gene expressions, which changes the amounts of proteins in the cell. Now, exercise may induce adaptations that have favorable health effects in various body tissues. One suggested mechanism is the effect that various hormones or cytokines, which are produced during exercise, may have gene regulation in body cells. So the hormone or cytokine binds to the cell receptor that you see there, and with that, it activates a signal within the cell. That signal is sent along this specific pathway, and then the signal can alter that gene expression and induce changes within the cell. The cell signals may also affect other enzymes or other cell structures that may induce beneficial health effects. There are other possibilities as well. There's local inflammation that's recognized as a risk factor for major chronic diseases. And so with that, exercise produces an anti-inflammatory cytokine to help cool down that inflammation. Some healthful adaptations do occur within a single bout of exercise, and some of those benefits are an improved blood lipid profile. So what you see is that the HDL, or the good cholesterol, goes up while the LDL goes down. You also see reduced blood pressure and an improvement in the insulin sensitivity. Cytokines and heat shock proteins from exercise help to prevent chronic diseases by reducing inflammation. Local inflammation is thought to promote the development of heart disease, cancer, diabetes, and dementia. Of course, there are health promoting benefits to exercise as well. Health problems associated with sarcopenia, or loss of muscle tissue. So do most of us exercise enough? Well, heck no. More than about 80% of adults and adolescents are not getting enough physical activity. That's why that Fitbit is so good at telling you you need to get up and be active. The majority of our older population are sedentary and sit for long periods of time. I know with my job now, a lot of my job is sitting, and so needing that reminder every hour to get up and go walk a little bit. I wore my Fitbit yesterday, and it was a normal day for the most part, except that I didn't have a lecture class. But I walked only about 8,000 steps, and hopefully you know that ideally you want about 10,000 steps per day. So I did work out. I did about 30 minutes on the elliptical and about 15 minutes on the bike, but still did not get to that 10,000 step mark. So now I did not have Did I have it? I did have it during the day, so it was a true representative of what my physical activity is. So I'm not quite getting where I need on my physical activity. Um, anyway, so how much physical activity is enough for health benefits? There is a curvilinear relationship associated with the amount of physical activity and health-related benefits. There are very few benefits associated with being sedentary. Really, probably the best place to be is somewhere in the moderate to high levels of activity, but there are adverse effects associated with excessive amounts of activity as well. And this is what that curvilinear relationship looks like. So you want to be in that sweet zone of the moderate to high is really where you want to be, as well as where you want to recommend your people that you're going to be working with. So how much activity is enough for health benefits? Looking at your program of physical activity, but also the My Activity Pyramid is another thing that you can look at. We'll look at it here in just a moment. So again, individualizing each exercise program. How much activity does this person get on a day-to-day basis? They need to be able to quantify that for you to some degree. 15 minutes, 20 minutes. Looking at decreasing the amount of sedentary activity that we do every day. So less sitting and more walking, exercising, things of that nature. We do need a certain amount of aerobic exercise as well as resistance exercise and flexibility every day. So this is kind of what your My Activity Pyramid looks like. You can see, since it is in a pyramid, ideally the things that you want to do the most of, and this should be part of your lifestyle, are biking, being out in the yard doing work, doing your household chores, or walking. It could be walking the dog, things of that nature. So you want to make sure that you're doing that every single day. As far as aerobic activity, you need at least 150 minutes of at a moderate intensity every week, or 75 minutes of vigorous activity each week, or a combination of both of those is nice too. So if you think about 150 minutes, it could be 30 minutes 5 days a week, or it could be 3 days a week, 50 minutes. However you want to do it, however you want to structure it is really up to you as the trainer or as the individual yourself. As far as strength and flexibility, they say you only need at least 2 days a week of strength. So modifying that now, if your goals are a little bit different, as far as if you're looking at sports performance, it's a little bit different. And we'll talk about that here in just a bit as well. But you need flexibility, so working on yoga or stretching 2 times each week. And then inactivity, you want to try to limit that each day. So sitting in front of the TV or the computer. So really, when we're talking about programs, we want to individualize it to the individual based upon their fitness level as well as their health status. Increased physical activity is going to benefit most everybody, but some are not experienced with it and they aren't comfortable. So they need guidance, they need help to help get them to that point. So trying to decrease our daily sedentary activity, trying to increase our daily leisure time, so walking, getting out, exercising, sit less and move more, get on that treadmill. So our exercise intensity looks something along this line. We look at it based upon the metabolic rate, which is in turn, we call it MET. And we'll talk about it a little bit more in chapter 3. But your metabolic rate at rest while sitting is you're using 1 MET. With exercise, with a moderate intensity exercise, you're going to be using about 3 to 6 METs. And vigorous would be 6 METs or even more. So some guidelines for you again. All adults should be engaging in moderate intensity aerobic exercise, walking, jogging, biking, things of that nature for a minimum of 150 minutes per week or about 30 minutes for 5 days. Now, if you're doing vigorous exercise, high intensity interval type training, HIIT, can be used if tolerated by that individual, but it would be a less of a time commitment. So it could be only 20 minutes or 15 minutes depending upon, again, the individual and the activity. With exercise intensity, oftentimes we use the talk test. So if you're able to carry on a normal conversation, that's usually considered to be a light intensity. If you're able to talk, but you're having to catch your breath a little bit, it might be moderate, and that's okay. Vigorous would be, it would be really difficult to vocalize while you're exercising. So you're running hard. You're not going to be able to vocalize on a consistent basis. So ideally, you want to be somewhere with a moderate to high intensity, or just depending upon your individual, what is needed. Some examples of moderate intensity and vigorous intensity aerobic exercise. Moderate intensity would be leisure bicycling, about 5 to 8 miles per hour. Walking leisurely, about 2 miles per hour. That's pretty slow, I'm just saying. Some dancing, jogging, swimming, Pilates, things of that nature. Vigorous would be bicycling about 12 miles per hour, walking at about 4.5 miles per hour faster. That sounds a little better. Or jogging or running about 4 miles per hour or faster. And basketball, tennis, things of that nature are going to be more of the vigorous activity. So as far as guidelines for resistance exercise, you want to do this again about 2 to 3 times per week, exercising all of the major muscle groups. So with that, you want about 8 to 10 different exercises, looking at the major muscle groups, and then doing about 8 to 12 repetitions. So working more on endurance versus strength, depending upon, again, your goals. This is for health-related fitness, not sport conditioning. And there's some more details later in Chapter 12 that we'll talk about. As far as guidelines for flexibility and balance, again, about 2 to 3 days per week. Older adults need to work more on balance really several times during the week because they are so prevalent for falls. And what they find is that with these falls, oftentimes they break a hip, and that ends up being kind of a life determining action that can be fatal for them later on down the road. So more is better. Again, you have to kind of balance that. So trying to work on increasing weekly exercise time is one way. People may tolerate it better by increasing the time versus increasing the intensity. So they're doing good at 150 minutes. Maybe they could do 300 minutes. So they're doing a little bit more each day. Best might be even 450 minutes. So again, maybe doing some every single day. If they have diabetes, the idea with diabetes, you want to try to keep that blood sugar constant. And so trying to do some exercise every single day is important for a diabetic. Am I exercising enough? One way you can note that is by keeping a daily record of your physical activity and comparing that with recommended guidelines. Using a Fitbit or the Apple Watch are great ways of assessing your levels of physical activity. Those have been great to the field in helping us to give people an idea of how much they're exercising and how much they need to exercise. So, can too much exercise be harmful to my health? Yes, there are some possible health problems associated with excessive or improper exercise. Orthopedic problems, back problems like I'm having now, can be impaired immune functions. Exercise-induced asthma is one of those. Usually asthmatics they can take something for that. They can take an inhaler before they exercise to help prevent some of those problems. Exercise addiction, we can get addicted to exercise. Yes, it's a great thing to exercise, but we can get addicted to it and overdo. There's also possible kidney failure along with heat-related illnesses and things of that nature as well. So possible dangers of exercise, of course, sudden death. Possible causes are usually something that is generic with the individual and their health. So that it could be a hypertrophic cardiomyopathy, which really means that the ventricles are hypertrophied, they're enlarged, and it's causing the heart to not be able to pump like it needs to. Oftentimes you'll find this in basketball players because they do so much cardio, their heart enlarges, and that's when they'll have a sudden death attack, if you will, on the court. Exercise-induced asthma, of course, is one. I have asthma, and it was something when I was younger. It was an issue. Mine was more caused by allergies than anything, and so you'd also have exercise-induced anaphylaxis, just like anaphylaxis with if you're allergic to a food item, kind of the same response. Most of the time, these things do not occur. It would be someone who is just starting an exercise program and is over-exercising, or they've got something that, again, is genetic with them or their lifestyle. So I want to thank you for joining me today, and I look forward to our next discussion. We'll be talking a little bit more about nutrition in our next discussion. All right. Talk to you soon. Take care.